Hi friends, today let's discuss about thyroid gland. Thyroid receptor beta 2 is predominant receptor on thyroid lobes, responsible for thyroid hormone mediated negative feedback. Sodium iodide synthetase NIS is expressed in thyroid follicular cells lactating breast salivary glands. Pendrin is iodide transporter. Deficiency leads to goiter and associated with sensory neural hearing loss. 220 microgram per day is iodine recommendation allowance in pregnancy. Excessive iodide transiently inhibits thyroid iodide organification known as Wolff-Chaikoff effect. Changes during pregnancy increased human chorionic gonadotropin leading to stimulation of thyroid stimulating hormone receptor X-linked thyroid binding globulin deficiency, in which normal free T4 low total T4 low total T3 thyroid hormone is seen. RTH beta, in which elevated free T4 elevated thyroid stimulating hormone is seen. Type 3 deiodinase enzyme inactivates T3 and T4 and is most important source of reverse T3, including in sick euthyroid syndrome. Thyroid receptor beta expression is highest in pituitary gland. Thyroid receptor antibody estimation TRAB to support diagnosis of Graves' disease to estimate risk of relapse in those with ATD treated Graves to predict fetal or neonatal thyroid toxicosis during last trimester of pregnancy. Serum TG levels are increased in all types of thyrotoxicosis except thyrotoxicosis factitia caused by self-administration of thyroid hormone. Thyroid dysgenesis is most common cause of congenital hypothyroidism. Lithium, amiodarone, sunitinib causes hypothyroidism. Transplacental transfer of anti-TSH or antibody has effects on fetal thyroid gland. Bioassays can be used to document that TSH or blocking antibodies reduce the cyclic AMP inducing effect of TSH on cultured TSH or expressing cells. Hypothyroidism, in which dry skin, hyperkeratosis, increased GAG expression in dermis is seen. Hashimoto encephalopathy, in which it is steroid responsive thyroperoxidase antibody positive presence of myoclonus is seen. Hypothyroidism increased in creatinine phosphokinase enzyme, increase in triglyceride level, increase in total cholesterol level. Levothyroxine dose needed to be increased up to 45% during pregnancy. Myxedema, levothyroxine IV bolus 200 to 400 microgram followed by daily oral dose of 1.6 microgram per kg per day. Use of space blankets IV hydrocortisone should be given 50 mg 6 hourly. In thyroid dermopathy is associated with ophthalmopathy leads to non-inflamed indurated plaque with purple color, orange skin appearance. Radioiodine treatment for hyperthyroidism worsens the eye disease. Thyrotoxicosis with low uptake on technetium thyroid scan is seen in thyroiditis, thyrotoxicosis factitia, that is self-administration of thyroid hormone and stroma ovary. Type 1 amiodarone induced thyroiditis, increased vascularity and color Doppler flow. Prednisone is used for treatment. Thyroid rats, in which in CT scan, if tumor is very hypoechoic, solid, wider than tall, there is high risk for thyroid cancer. Most patients with solitary hyperfunctioning toxic adenoma have acquired somatic activating mutations in TSH receptor. Follicular epithelial thyroid malignancy, papillary thyroid cancer, Arthel cell carcinoma, anaplastic cancer of thyroid. These are the types of follicular variety. Risk factor for follicular epithelial thyroid malignancy. It's seen in male head and neck irradiation between 0 to 18 years of age causes. Follicular epithelial thyroid malignancy, papillary thyroid cancer is most common type of thyroid cancer. Distinction between benign and malignant follicular neoplasms required histology because the nuclear features between these benign and malignant types do not differ. Thank you.